Hello, my name is Cameron Leafloor from the Ottawa Hospital Research Institute, and I'll be presenting to you my abstract on internal medicine residents' duty hours, a systematic review and meta-analysis. So resident duty hours, how much time they spend in the hospital and what the quantity of time they spend on things like education, communication, direct patient care, etc., have often been scrutinized for too long, extraneous work hours and literal supervision. In 2013, the Ottawa Hospital Internal Medicine Residency Program was undergoing a change in which we were adopting a night float system. To determine what effects this night float system would have on the residents, we wanted to do a time motion study. So a method of data capture in which an observer would follow the residents around and time them on all the tasks they did to determine the composition of their workday. And in order to do that, we wanted to determine previously what time motion studies were out there on internal medicine residents and what they said about the composition of workflow. So we decided to do a systematic review and meta-analysis of all time motion studies on internal medicine residents in the previous literature. To begin our time motion study systematic review, we reviewed articles in PubMed, SynHall, and Medline. We came up with 468 articles, and after removing duplicates and other studies which we felt methods were invaluable, we came up with 8 articles solely about time motion studies on internal medicine residents. So these are the 8 articles that we found spanning from 1971 all the way up to 2013. After the meta-analysis, we determined that an average of 13.8% was spent in education, 18.1% in communication with staff, 6.6% in transit, 41.8% in direct patient care, and 19.7% in personal or miscellaneous tasks. When we compared pre- and post-ACGME duty hour studies, we found that there were no significant changes to the quantity of resident education in any of the categories that we had mentioned: communication, direct care, education, patient care, or personal other. We felt that education was low across the board in all studies, especially since these are academic health centers. Studies reported that with the change in duty hours, residents felt that there was a decrease in the quantity and quality of education and an increase in the amount of self-directed learning. Research is conflicting upon the impacts of morbidity or mortality. Some research papers reporting an increase in morbidity and mortality with changing duty hours, and some reporting no change at all. Moving forward, this systematic review will help us develop our time motion study. The biggest limitation of this project was the vast heterogeneity in the data presentation between each article. So this will help us build a time motion study that is conclusive of all the different papers that are out there and concise so that we can capture the best data possible.